I'm Tia.
Hi, I'm Ella.
And welcome back to a sit down with medical students.
No, just be prepared for long ward rounds.
Yeah, really long ward rounds. Miss your lunch and everything.
Boring. Don't do it. It's boring. I don't like it. I hate it. I don't want to do it. So thoughts on medical specialties? Boring. That's my answer.
Yeah, I definitely prefer medicine over surgery because I just don't like surgery, so that leaves medicine as the one that's better. Bit of a default, to be honest.
Yeah. You like medicine?
Yeah, I like medicine. I don't know if I like all the medical specialties. Like, there's some I like more than others, but I definitely preferred my medical placements to my surgery placements.
To be fair, I really enjoy medicine. I think I prefer it more than surgery, to be honest. Surgery's a lot more, I'd say, fast paced, and like the turnover's a lot fast. Like in TNO, the amount of beds that get turned over is very quickly. Whereas medicine, I'd say, is a lot more slower. For example, I was on the cardiology ward the other week, and you can actually, I don't know, care for your patients, get to know surgery's like boom, 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 get out. Do you know what I mean? Medicine's a bit more calm. Okay, let's solve the problem. Let's not just triage and let's send them here and there.
Medicine's alright, but I prefer surgery, I'm not gonna lie.
So medicine is not my top choice of kind of job, I'll be honest.
In medicine, I feel like ward rounds just take ages.
Yeah,
And like signing yourself away to ward rounds that take ages is a lot.
I don't think that gives more like holistic care then. You can actually get to know the patient.
Yeah, probably.
Whereas in surgery, it's like, okay, well, like I said, move on to the next person. They've had the surgery, let's go.
I think it just depends where you get, and the ward rounds are just too long. They're so boring. And your legs are hurting and you're just sat there just waiting, and they usually ignore you.
No, but I like the long ward rounds, because then, I don't know, I feel like you actually learn from it, because then the consultants tend to ask you bits of questions on each patient's got different things wrong with them.
I don't necessarily enjoy the long ward rounds on medicine. I'm not someone that can stand around for too long, and on the medicine ward rounds, you're standing for a very long time. It's just not necessarily my kind of, job I think that I would go for. And I think also my brain doesn't necessarily think in that way. I think it takes a lot of lateral thinking with medicine, and you've got to think a lot about patients' other co-morbidities, and just there's so many other things to think about than what's in front of you when it comes to medicine. And I suppose the same is for surgery, but I feel like it's more so with med, and I'm just not that kind of person, to be honest.
On gastro, one patient would be liver disease, and then the next patient would have Crohn's.
Ella loves the alcoholics. She'd come back from placement and she'd be like, I've seen this alcoholic and I've seen this alcoholic and
I just think the liver and the gallbladder makes sense, doesn't it? The colon's a bit rogue.
I actually don't mind ward rounds. I feel like as a medical student they're a bit boring, so you don't really do much, but I can imagine when you're a doctor it'd actually be okay. Yeah. And you always doing stuff on ward rounds, and I think if you like to be busy then it's probably good.
Yeah, but then in comparison to surgery, sitting and watching surgery I think is a lot more boring.
Yeah.
So, and there's nothing you can really do. I mean, sometimes they get you to scrub in, but I hate when they do.
I feel like you feel really awkward as well, because you're stood in the corner. Yeah. And then you just feel like you can't talk, but then if you but I don't know, it's just all really awkward. Yeah. And then if you do talk, then you feel like you're getting in the way of their surgery, or they're going to do something wrong because of you, or I don't know.
Yeah. Yeah, and it's all a very tense environment.
Long ward rounds in medicine. I'd rather be stood in theatre than be on a long ward round, being ignored as a med student. Some people disagree, but because at least you're watching something, do you know what I mean? I don't know. But I guess ward rounds you can learn more stuff maybe, but...
One thing I think that's a bit mad about medicine really is the mythology of the med reg. I feel like the med reg is some sort of Swiss Army knife that is a supercomputer that gets all these things, and there's all this stuff surrounding the med reg, when you're handing over too much or when you're handing over too little. But I actually think that being a med reg and being a sick med reg would be really cool. I don't think I want to do medicine, but I would. Having a med reg kind of role, I feel is a good way of trying to be your best, really.
A lot of it's the content. With medicine you can really get stuck into the content, because it is a lot of nitty-gritty physiology that links into all of the pharmacology and stuff, which is nice. If you're interested in it, it's nice. If you're not, it's kind of like, oh my god, this is a lot of information, and I'm a bit like mind blown by it. But with medicine it depends as well, because sometimes you go on a ward and you just get ignored and you just kind of hate it, and also when there's a few too many people, you all kind of like shuffle around and then you all pull you in. What's that thing? It's like your role is to, when you go in, I was about to say you shuffle into the side rooms and you're all kind of like crammed in like sardines, and then when you're on the ward, when it's all the curtains and you're just like the professional curtain puller, but then another medical thing comes on, you're like, I'm like deputy curtain puller now, I'm not even the main thing.
Or you like go to pull the curtain and it gets stuck and you're like, I literally have one job.
Yeah. Me and Ella in second year would be doing that all the time, and it'd be like, and we'd be looking at each other, I've got it, yeah, I've got it, right.
Yeah.
I've got this, and then next time she'd be like, I've got it, I'm like, great, okay.
That's the thing, I think you only necessarily in third year, you only like the thing that you had like good teaching or good placement in.
Yeah.
It kind of depends, like I had really good teaching in gastro in second year and in third year, and I understand it better because I had all them things, so I obviously like it better than like reading ECGs because I don't understand them.
Yeah, but I really like cardio, but I think that's because I did it at Blackpool, and then it's like a big cardiac centre for the North West in it as well.
Yeah.
And like ECGs, it's like a nice pad.
No, it's not. No, it's not.
No, once you understand it, like you're like,
I don't understand it, that's the point.
Then that goes for all medicine, well, all medicine and surgery. Like if someone's keen to teach, it just makes such a big difference. And then it does make you like, if the people you're on placement with are keen and they want to teach you things, then you're like, it makes you like the placement more. And but then it's difficult because you're like, am I actually interested in that specialty, or is it just because I've had a good placement there?
Medical clinics before, so like cardio and gastro, and the main reason I don't like it is because I've been to clinics before where it's like the patient comes in and they're complaining of this awful symptom, and the doctor just goes like, oh, okay, so we've tried you on this and you're still having these symptoms, we're going to try you on this and see what happens, we'll see you in 3 months or 6 months or whatever. There isn't like an instant result, and I'm not a patient person, and it's just not for me.
So my favourite medical specialty is ED. It's because I love the acute side and I really like trauma and resus. Oh yeah, I love a bit of ED.
Tell us why do you like ED?
I don't know, it's just like...
ED is in like...
Emergency department, A&E.
Oh right.
Is that medical, yeah?
Because on my flashcards ED means something else.
What does it mean?
Neurology.
I'd have to say my favourite would be probably derm, you know.
Classic.
Classic. I say derm because you don't have like, it's not like your typical medical specialty where you like on long ward rounds, it's just like a lot of clinics and just good lifestyle. And I'm all for good skin, do you know what I mean?
my favourite medical specialty is definitely cardio, but I think that's probably, or even gastro, but I think that's because you get the mix of both like the medicine and some form of surgery side, like you're not just pure medicine, you've got that mix of doing a bit of both, and I think that's the best bit. Bit of a range.
I think my favourite this year has been Jerry's. I really enjoyed Jerry's. I think like you can be very swayed by the people who work in the hospitals. Like there was a really nice consultant at Warrington called Dr. Gomez. Yeah, I really enjoyed it. I just really like old people.
No, I'm an acute medicine. I don't know about that really. Yeah, I'm a bit of a adrenaline junkie, I would say. So I think A&E or like acute medicine.
I really like the acute side of it, so treating patients, for example resus.
Yeah.
You're there and there's like the buzz of, let's say, doing an A2E assessment with 15 doctors surrounding you. It can be very traumatic for the patient, don't get me wrong.
Yeah.
But you're in a very high pressure situation.
Yeah.
And you have to remain calm.
The first medical specialty that comes to my mind is hands down gastroenterology. And I've got no idea why, but I've always really enjoyed gastroenterology and, you know, gastric problems, intestinal problems, and even the kind of hepatology side of it as well.
My favourite medical specialty is dermatology. I think there's loads of differentials, and there's really good work-life balance, and there's a good sort of level of research that you can do to change the field.
I think that's like a little bit of what it is, because you're like, I enjoy this for like the time that I'm there, but I don't want to do this long term. Like I think that's a different question, isn't it? Like derm is interesting when you're in a clinic, but could you do eczema clinics for the rest of your life?
Yeah, when you say that. No, you're not.
I'd say peds because it interests me the most, paediatrics, but I've actually not had a proper placement on there. Well, we had ENT, but that was surgical, so yeah. And paediatrics, is that even medical? It's like half medical, half surgical, isn't it? Really?
Yeah.
But the clinics I've had have been good. Quite like that.
really enjoyed palliative,
Really?
but I think I was at a really good hospice. And you think it'd be really sad, like all these negative emotions, but it's actually, if you're doing it in the right way, it should be like a really good like end to someone's life. And you can like make those last days like really not enjoyable, but the best they can be. I just really enjoyed it. I don't know whether it'd be something I'd go into, but
Yeah, I think that's like
Pediatrics, that counts as a medical specialty? Yeah. Pediatrics would be kind of my next best after gastroenterology. I really liked working with kids for some reason. Don't know how or where that came from, but I really, really enjoyed it. And doing my gastro placement was really, really eye-opening. I don't think I realised or appreciated how unwell patients on gastro wards can be, and how quickly and acute the care is that they need. And I think that was really eye-opening for me. Being on gastro.
No, I think my favourite's gastro. I didn't really like the rest of them, to be honest. Like gastro definitely is the one that like stuck out. Yeah, again, I think that's because I understand it, and you get quite a lot of variety. Like the GI tract, it's all the way from there. I don't know.
Yeah, so
there's
much
different
variety.
organs in there. So, well, I don't know. I prefer it. Don't judge.
yeah,
Acute med palliative and
quite a mixed bag.